Hello everyone, I am Kachin Kimitiwanin, student nurse at Davao Doctors College. Today I will be performing my return demonstration about female urinary catheterization, which allows urine to drain if you have an obstruction in the tube that carries urine out of the bladder. So I have here the equipment that I will be using for the procedure, the set of the catheter. In here is the catheter, urinary bag, 10 cc syringe, eye sheet, and gloves. We also have here the lubricant, the antiseptic, sterile water, tape as plaster, cotton balls soaked in antiseptic, and the surgical scissors as forceps. So now check the doctor's order for catheterization to ensure that you have the right patient and right procedure to be done. So now, perform hand washing before preparing the set. This is to reduce microorganisms that cause disease and contamination. Now, identify the patient and explain the procedure. This is the patient will feel reassured if the procedure is explained and if she is handled gently and considerately. So, good morning, ma'am. For today, we will do the procedure of indrilling urinary catheter that came from the doctor's order. This will relieve your acute or chronic urinary retention. And I will be exposing your genital area in order to complete the procedure. Is that okay with you? So now, provide privacy by screening or closing the room and position the patient in a dorsal recumbent with the knees flex. And this is to good visualization of the meatus is essential to introduce the catheter. Gravity will aid the flow of the urine when the bladder is higher than the end of the catheter. Secure the urinary bag on the patient's bed frame, and urinary bag should be below waist level. And now, drape the patient, exposing only the area to be used. Embarrassment and chillness will make the client become tense, and tension may interfere with the easy introduction of the catheter. And also place a waterproof pad. And now, apply direct light for visualization of genital area. This is to have better visualization of the area. And now, open the tray and arrange equipment for convenience and accordingly to avoid contamination of the sterile items. Now, using the sterile forceps, cleanse the area using a cotton ball with betadine. Thorough cleansing will prevent contamination. And now, do the cleaning from the mons pubis down to the anus. And discard. Now, mons pubis to labia majora down to the anus. And discard. Do the opposite side. Mons pubis to labia majora down to the anus. And discard. Now, mons pubis to labia minora down to the anus and discard. And do the opposite side. And discard. And now, open the set and observing sterile technique. Now, put on the sterile gloves to prevent contamination and to maintain the sterility of the set. And now, put the eye sheet. And now, lubricate the catheter for about 1 1/2 inches, being careful not to plug the eye of the catheter. Lubrication reduces friction and prevents urethral trauma, thus reducing pain upon insertion. And now, pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb and one finger of the left or right hand between the labia minora and separate and pull up gently. Separating the area surrounds the meatus provides visibility. Now, insert the catheter. If a specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen container in position. Urine will flow out of the catheter if lumen is not occluded. And now, rest the hand in the pubis area while holding the catheter in place to prevent pulling and pushing of the catheter. Withdrawing the catheter and pushing it back in the urethra increases the possibility of contamination to the urethra. Now connect the catheter to the urine bag. And now inflate the balloon 10 to 15 cc of sterile water using a 15 to 20 cc syringe, making it sure that there will be no leakage of water from the balloon. Thus, it serves the purpose of anchoring into the bladder. And now secure the indwelling catheter by taping it to the patient's thigh. Allow some slack of the tubing to accommodate the patient's movement. This is to secure that the catheter properly, and slack prevents tension on the catheter when the patient moves. And now, remove the eye sheet. And now, place the patient comfortable. And after that, do the aftercare. And now perform hand washing or hand hygiene to prevent the spread of microorganisms. And now, record the time of procedure done, amount and color of initial output, and also cleaning the environment promotes comfort to the client, and moisture is a good environment for bacterial growth. So for the documentation of the urinary catheterization, we should always include the date and also the time of the procedure, the type, size of the catheter used, and also I use a two-way Foley catheter, latex silicone coated. Its size is 14 French. Also, record the amount of fluid used to inflate the balloon, and I use 10 cc syringe, 10 cc sterile water, and also do not forget to document the character and amount of urine, the reaction and response of the patient, and also include other significant observations. So that's all for my return demonstration about female urinary catheterization.